If you're looking to build strong legs, work on part of your squat technique, and strengthen your core, then the Goblet Squat is a great place to start. I'm going to go over the main muscle groups that are trained, the benefits of doing a Goblet Squat, and how to actually do this exercise. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. The Goblet Squat's a great squat variation for beginners, and it can help prepare you for a front squat since much of the positioning for these lifts is similar. A Goblet Squat, it's mainly a lower body exercise that involves holding a dumbbell or a kettlebell close to your chest and then squatting. It's considered a knee movement that trains your quads, glutes, hamstrings, and core muscles. Since the weight is held in front of your chest, the lumbar extensors in the lower back are activated to resist the weight pulling you forward. And other trunk stabilizers like transverse abdominis, which is one of the deeper abdominal muscles, are also activated. One benefit of the Goblet Squat is you don't need as much thoracic mobility, meaning mobility in your upper back, as you would in a front squat, because the positioning in the Goblet Squat, the elbows are down compared to the front squat where the elbows are up. Another benefit of the squat variation is that because a lighter weight is typically used, it's easier to keep your torso upright, and keeping your torso upright, that's going to help reduce shear stress in the lumbar spine, meaning the lower back. And the Goblet Squat is also less technically demanding than other squat variations. Remember to hit the notification bell so that you're one of the first to know when my next video comes out. Grab a dumbbell or a kettlebell and hold it vertically against your chest with both hands, elbows pointing down. If you're using a kettlebell, hold the handle with both hands. If you're using a dumbbell, place the heel of each hand on the underside of the top weight plate. This is going to be your starting position. Stand with your feet shoulder width apart. Toes are going to be pointing out to about 30 degrees. Brace your abs, squeeze your chest to the ceiling, and reach your hips to the back wall as you start to bend your knees. Hold the weight close to your chest and go as low as you can safely go, ideally with your thighs or your hip crease dropping below parallel to the ground. Heels should stay flat on the floor. Maintain a flat back and keep the knees tracking over your feet. Make sure that you're breathing throughout the exercise. Stand back up, keeping that chest squeezed up. And as you progress, you can actually hold the weight a few inches in front of you. This is going to enable a better counterbalance for the movement and can help develop squat mobility. Some common mistakes include rounding the back, so make sure that you keep that chest pulled upward, and heels can sometimes come off the ground, so make sure that your weight is evenly distributed across the entire foot. And lastly, it's common for the knees to start to cave in, so make sure that you keep your knees tracking over the feet. Make sure that you start off with a light weight and really just get comfortable with the movement. You can then start to work on your mobility, meaning getting deeper and deeper into the squat, and then start to increase the weight. Make sure that you discuss any lifestyle changes like starting an exercise program with your doctor first. Thanks for watching.